Hello everyone, it's Mo here, and today we're going to be speaking about atrial fibrillation, the causes and the treatment of AF. So let's get going. We're going to start off with the ECG, and it's really important that you know how to interpret an ECG in origin, but more specifically atrial fibrillation, because it's so common and it's so commonly tested. It's just so common. The most obvious thing, and really what's diagnostic about an ECG with atrial fibrillation, is the lack of P waves, which you can appreciate throughout this ECG prior to the QRS complexes. Very, very difficult to see P waves. There might be a few that you might spot, the odd ones, but largely speaking, no P waves before QRSs. The other thing is the irregular nature of this. So the number of squares between each QRS complex differs with each passing beat. And there you have it, AF on an ECG. The causes of AF are plentiful and can occur spontaneously, and when you do have a patient with atrial fibrillation, the first thing really is to find out what caused the atrial fibrillation. Lots of mnemonics out there, one of which is PIRATES, and this is quite a good one to make you start thinking like a clinician and start you in the process of investigating the cause. So pulmonary embolism, iatrogenic, for example, so it could be random, rheumatic heart disease, especially mitral valve regurgitation or even mitral stenosis causing atrial fibrillation, atherosclerosis, thyrotoxicosis, ethanol, and even sepsis. The tricky thing is managing atrial fibrillation, and this is what I wanted to focus on primarily. You have two approaches, rate control versus rhythm control, and they're very simple. Rate control is really trying to slow the heart down so the patient will stay in AF but at a controlled rate. Rhythm control is to try and take them out of the atrial fibrillation rhythm and bring them back to normal sinus rhythm. Rate control or rate control approach is primarily used for patients who are slightly older, so over the age of 65 years old, who have persistent atrial fibrillation, so it's continuous, have a background of hypertension, because hypertension itself can cause atrial fibrillation, so you might bring them back into sinus rhythm, but because they've got this causative factor, they might just flip back into AF, and no history of heart failure, because the management of heart failure can be troubled and complicated with the management of rhythm control for atrial fibrillation. In order for rate control to be focused on, you would use rate controlling drugs, such as beta blockers, for example, which is the mainstay of treatment. But in rhythm control, in younger patients who don't have persistent AF, you try other novel methods. You try electrical cardioversion, for instance, or chemical cardioversion via amiodarone or flecainide, which each can have their complications, but can be successful in flipping someone back to normal sinus rhythm. And that's it. That's AF for you, and I hope that's been helpful. So until next time, guys, see you later.